Well, being a medical home is very a very complex endeavor, and it really represents significant change from the way practices typically function. We all think that we're providing a medical home, but when we really think about all the things that we could do for kids and families in a true family-centered medical home, it requires a lot of change in your practice, and making changes in how we do things is not easy. And making sure that the changes that we make are actually improvements really requires processes that are rigorous and have systematic approaches to them. And that's what we call quality improvement. It's an approach to making change that is driven by your aims and what the kinds of changes you want to make, but is guided by what we call iterative cycles, or plan, do, study, act cycles, which enable you to make a small change and make sure that was the kind of change you wanted to make, find out the barriers that got in the way, fix those, redesign your plan, and keep doing that incrementally until you get to the change that you want. And that involves the whole practice. It involves everybody, from the front desk to the MAs to the nurses to the administrative staff, as well as the physicians and other clinicians. So being able to get the whole team together to make that work really lets you make the changes that you wanted to make and get there much more quickly. And I think also building the systems that are required to sustain those changes, because we don't want to lose those benefits once we move on to the next change. So doing all that is a very complex process. It really requires a considered approach, and that's what we think of as quality improvement.